Hi, my name is Marie and I'm a midwife specialist with 28 years of experience. I want to discuss the topic of induction of labor. So mommies often wonder, why should she have an induction? So the reasons for inductions are usually baby's not growing well, reduced amniotic fluids, placenta that is calcified. And of course, if your membrane's ruptured, your water break, then we need to get the baby out. There's a couple of medical ways how we are doing induction. First, we're going to check the cervix to estimate what the cervix is looking like, because that's going to give us an idea on what type of induction we're using. So we look at the consistency of the cervix, how soft it is or how hard it is. We look at the length of the cervix. If the cervix go down from 5 centimeters long in pregnancy to hopefully about 2 or 1 centimeter prior to labor. If the cervix is favorable, we've got a really good opportunity to have a natural birth with an induction. However, if the cervix is unfavorable, inductions will not work and you might need to go for a C-section. Understanding that, the methods of doing an induction would be either a prostaglandin gel that we put into the vagina behind the cervix, leave it for 6 hours and see how it ripens the cervix. Often we need to repeat that. So induction, it doesn't happen quickly. It's usually a 12-hour plus event to ripen the cervix, to get it in a favorable state so that labor and birth can take place. Secondly, there's things like a prostaglandin tablet that we put in with a little string that we can remove if the contractions is getting too strong. And then also we can break the water if the cervix is open already, just to get the labor to come faster so that we can actually get the baby out. Then while you are infused by this Propes or Prandin gel, which is the brand name for prostaglandin, we often then might put up an oxytocin drip. And the oxytocin is a synthetic natural hormone. So it's synthetic, but your body is supposed to be giving out oxytocin while in labor, just to make sure that the contractions are consistent and strong enough to make labor possible. Let's talk about the Bishop score. So a Bishop score is a score that we do when we check your cervix. And ideally, it works out of 10. So we look at the softness of the cervix, we look at the position of the baby's head in the pelvis, we look at whether the cervix is slightly dilated or not, and then we look at the position of the cervix. So usually in pregnancy, the cervix is way towards the back, but when it's ready for labor and birth, it's sort of come towards the front, and that is ideal. So we will give you a point on each of those and get a score out of 10. If the Bishop score is less than 7, chances of having a successful induction is very poor. If it's more than 7, you're good to go. It will most probably be a good, favorable induction with a beautiful natural outcome.